Hello, all. Our ethics lecture for this year is Patient Centered Care, Effective Patient Education and Communication. I hope you like this. There are multiple communication challenges for the physicians. There are multiple factors. Our patients are sick, they're in pain, anxious, have high expectations, they're vulnerable, they're feeling out of control. And for patients' families, they're distressed and again have high expectations, which is fueled by internet, media, and we are also under significant consumer scrutiny, which HCAHPS and CGCAHPS. You heard of these scores before, I'm pretty sure. Again, there's a competition for referrals, and patient loyalty is really, if you're not taking any insurance, insurance is patient, it's not your patient really. We are working under extreme job stress and pressure. We're also dealing with a lot of changes. Change, and more change. Pay for performance, ACOs, PCMH, productivity pressures, organization-wide patient experience strategies, multiple different things we're facing, and it gets very challenging to really communicate that well to the patient when you're under that kind of stress. If we are not able to communicate effectively, what are the dangers? What can happen? Patient adherence to the care plan will be diminished. That leads to medical errors, adverse events, complications, more lawsuits. Your reputation will suffer. Referrals may be limited. Patient may defect to other providers. If you're working under a pay for performance kind of model, then there'll be subpar pay for performance. And more than that, unsatisfying patient-doctor relationship makes the practice of medicine really unfulfilling. The Institute of Medicine landmark report, which was Crossing the Quality Chasm, this was released in 2001. It had 6 aims for improvement, and it identifies patient-centeredness or patient-centered care as an essential element of quality care. Here's the definition. Please pay attention. This is healthcare that establishes partnership among practitioners, patients, and their families. It's important, and their families, to ensure that decisions respect patients' wants, needs, and preferences. So you can see in this definition that patient is right, left, and center. It's patients' wants, needs, and preferences. And that patients have the education and support from their practitioners to make decisions and participate in their own care. Pretty loaded definition where you can see that patients are right, left, and center. How would strengthening the patient-physician communication benefit everyone? I think it will earn patient respect and loyalty. Your co-workers will also like how you are dealing with the patients. It will lead to more fulfilling work, personal growth, outcomes will be better, patient and family experience will be better, and higher performance scores will lead to higher earnings as well. There are 7 best practices I would like to talk about, which are essential for patient-centered communication. What are those 7 best practices? Mindful practice, communicating with empathy, engaging patients and families as partners, effective opening and closings, effective explanations, hard conversations, and collaboration and teamwork. Mindful practice. Only when you are mindful with your patients, you will release your innate compassion. Mindfulness is really presence of heart. The definition really is paying attention. By that I mean undivided attention. Staying on the purpose and goal consciously. This behavior can be learned. Stay in the present moment, and hard to do but important, without judging. So how do you develop the skills of mindful practice? Take some deep breaths, quiet your racing mind, bring your full attention to the present moment and person at hand. Actually, what we teach our patients of diaphragmatic breathing helps in mindfulness as well, where you are sitting on your chair or wherever you are sitting. Put your hand on your belly, close your eyes, take a deep breath. Four seconds in, 6 seconds out. By taking few of these breaths, you will see that how you are really sitting in the present, and your mind is not racing. When you're sitting with the patient, sit and lean in, adopt an open, receptive posture. When your patient or any person is speaking, maintain eye contact, be quiet, don't interrupt. Do not think about what you're going to say or do next. This is very commonly, we all have answer ready before even other person has finished their sentence. You know, most physicians will interrupt their patients within first 20 seconds of what they're telling you. Avoid multitasking. While patient is talking, don't look at the computer and start jotting your notes, or look at the phone, or look at the watch. I have made it a point that I leave my cell phone in my office while in the patient's room, just to avoid that one distraction. Make sure your office staff knows that they will not interrupt you unless it's absolutely necessary, and tune in with your patient fully. Yes, this is very easy to say. Can we really do this? How can I do this in this era of electronics and gadgets, interruptions all the time? So here's some tips in using technology when you are with a patient. Log in and explain what you're doing. When you have urge to take some notes, you alternate the focus of your attention instead of trying to multitask. See, let me write this down before I forget, or something like that. Tell your patient. Engage your patient with the device and information on it. Just show them. What I do in my practice is I show them their pictures, explain to them what this is, talk about their pathology, show them their pathology, show them their labs, show them their red labs, show them their out of range labs, what that means on the screen. And they really like that. One more important thing would be to log in and out in front of the patient, because now they know that you are respecting their confidentiality. So, second, moving on to collaboration and teamwork, which is our second point we're going to discuss. Together, our care is greater than sum of its parts. 1 plus 1 equals 11, not 2. That's a great teamwork. So, according to Institute of Healthcare Improvement, effective collaboration results in better coordination of patient care. We all know that. Improved compliance of core measures, if you're recording all those core measures, such as safety, pain control, and patient outcomes. Shorter length of stay for inpatients. Of course, if you have elective collaboration and you know that hospitalist is communicating to you, and we know that patient's NPO, not NPO, so that will help in a timely procedures, and there will be shorter length of stay for inpatients. Decrease ER use because patient is not discharged inappropriately. Fewer nursing home admissions following inpatient stay. Decreased mortality 1 year after discharge. This is all proven in the studies. Decreased overall healthcare cost, and most of all, improved satisfaction for the patients, for employees, and for physicians. So how do we do this? First of all, acknowledge and appreciate everyone's involved in patient's care. For example, my PA comes out of my patient's room and they're like, "Oh, your PA is awesome." And I'm going to, yes, she is great. She's with me for that many years. She's my right hand. She's my extension. So we really talk about and really appreciate the people who are working with us, right? Invite the diverse perspective. If your colleague is something different, like, "Can we do this way, doctor, or this way, sir?" Yes, you can. Let's talk about this. Communicate with empathy and strained interaction with the coworkers. Sometimes it's difficult. I mean, I was on call this past weekend and I was getting bombarded with multiple different phone calls, and I was less than stellar in one of the communication to one of my coworkers, and I realized that. And I think it's important that we communicate with empathy in strained interactions with the coworkers. Transfer trust during handoffs. I saw the patient over the weekend, and now the procedure is being done by one of my colleagues, and I will say to the patient, and rightfully so, I'm not lying, that my colleague is excellent, you don't have to worry about it, he will take very good care of you. That's just transferring the trust during handoffs. That's important. Whenever you're asking for some help from your team, make sure you have it in a clear and caring manner. You really need to communicate all what you really want. Hey, I'm going to see this patient at 4 p.m. today. Make sure this test result is back by then, or something like that, rather than not clearly telling your colleagues or your office staff and then not having the results and getting mad at them afterwards. So let's move on to next one, which is effective openings. So before you enter your patient's room, prepare. Make sure you have looked at the chart, why the patient is coming in. We usually have a sheet which is printed of patient's appointments, and then it has written down why patient is coming in. I try to go through very quickly all of my patients the day prior to seeing the patients within my endoscopy run and starting the clinic. Sometimes I do it night or evening before. Sometimes you don't get any time for do this, so that time when you come in you see your patient, you will say, let me log in, let me look at your chart, let me refresh my memory for a bit. So then patient know that, okay, what you're doing. I think the first 6 seconds are the most important, where you are really introducing yourself, making eye contact, sitting next to the patient, leaning in, adopting an open posture, and greetings. That's very, very important. So not all the time is it's feasible, but you can personalize care by showing knowledge about the patient, talking. You know that if they like football, talk football a little bit. You know that they just recently had a vacation. If you remember from the last time, just ask about that a little bit. Exchange some pleasantries if you can, and elicit all the patient's concerns and care. And ultimately, at the end, use we most of the times, not I or you, and negotiate the agenda together. Once done with the encounter, make sure that you have answered all the questions for your patients. Use this teach back technique, where you summarize what we talked about, then let patient repeat, and then summarize again. It really literally takes less than 2 minutes to do all that, but it is very important that patient understands, because so they can adhere to their treatment plan. Let's say I saw a patient who has constipation, who has a fatty liver. We just did an endoscopy. We found a grade D erosive esophagitis. So once we're done with this, we talk about, hey, you have this. So let's summarize this. You had grade D esophagitis, reflux disease. This is the treatment. We're repeating endoscopy in 8 weeks. Constipation, we discussed this. For fatty liver, we discussed this. And then let them relay that back to you. It takes about 2 minutes, but I think it will help in a long way. Ensure the closure, like with teach back technique, and make the last 6 seconds a very positive memory. Remember, the last impression you make leaves a lasting impression on your patient. This is a good example of really engaging. So engaging patients and families as partners. Okay. So we as physicians are expert on patient's diagnosis, diseases, treatments, remedies, what ifs, what happens if this doesn't happen, and medical resources. But patient is expert on their symptoms, their goals and priorities, what they really want to get out of this appointment today, their feelings and their concerns, their tradition, culture, and values, and what resources they have to follow through on the recommendations which you're giving to the patients. So I ask question to the patients, how would you like to participate in your care? How you and I work together to solve the issue? When I talk about shared information, I know that some of these patients are browsing the internet. So I see that you have been browsing the internet for information. Let's sort these things together. So shared information, we deliberate sharedly, and then shared mind. That's how you engage your patients and families. During the interview process, encourage your patients and family to speak up. If they're not telling you, you can really see during your interview that they're concerned about something, they're hiding something. You're gonna encourage them to speak up. Share the responsibility of direction or discussion. So now what happens is, let's say discussion is going some way, but not going the way you intend it to be, to really help that patient in that direction. So at that point, if patient is talking tangentially, you are going to change the direction of the discussion. It's important to find out when patients are searching on the internet, it's important to find out what patients' views and theories. Why do you think that way? Doc, I am allergic to gluten. Why do you feel that way? Whenever I have gluten, I have these symptoms. That can be irritable bowel syndrome, but let's talk more about it. Where do you get this idea? Then you know that they're searching the internet, they're Googling, Dr. Google. So it's important to really get patients' views, to really get to the bottom of what they're talking about. Very important that you involve patients' families, because families are really caring for the loved ones at home. Young people, it's usually spouse or significant other. Older people, it's usually kids. Younger children, it's usually parents. So you know that they are involved in their care. So it's very important to involve the family as partners as well. So, communicating with empathy. How does that work? There's two kinds of conversations. One is heart to heart, second is head to head. We all know that when you have a heart to heart conversation, it is about emotions, concerns. It's very personal, very subjective, very empathetic. When you talk about head to head conversation, we know that this is about the task or the problem at hand. It's very rational. It's based on the facts, and it's very information oriented. There's advantages of both kinds of conversations. Heart to heart, which patient really thinks that you're very empathetic, but head to head conversation really brings up the results and for the treatment of the patient. So technique is that you start with heart to heart conversation, then sandwich a real deal, which is head to head conversation, and then end with heart to heart conversation. So acknowledge the person's feelings, what they're feeling, how they're feeling. Further pursue it. For how long are you having this problem? Yes, I know, I see that you're suffering. Tell me a little more about it. Important to validate or legitimize the patient or family member's feelings. Yes, I see that you're suffering from Crohn's disease for a long time. I also see that in the history that you have multiple surgeries. Now you're finally on biologics, you're doing fine. Just let it legitimize the patient's and family's feelings. It's very important to give a non-verbal clues that you're really listening. That dentist is really not giving the explanations. Again, what is the effective explanation really? Ask the patient what they're telling you, listen to them, do not interrupt in first 20 seconds. Then tell them, okay, I hear you, I heard, that's what you're telling me, correct. Therefore, ask, so you really want to basically repeat what they have said so they know that you are listening. Encourage your patients to ask questions at any time during your explanations. Elicit where their knowledge is coming from. State your positive intent. Again, at the end of the day, it is all about the patient. So you are really telling them, hey, I am here to help you. I am here for you. We will get through this together. So those are the statements you make, which makes the patient feel that you are listening and you are really interesting in their well-being. Explain in a way that is easy to understand. Don't use the medical jargons. Hey, you had a cabbage for myocardial infarction. You had a heart surgery for heart attack. take this medication PRN. You will take this medication on as needed basis. So make sure that they understand what you're talking about. Don't overwhelm your patients with multiple explanations at one time. Rule of thumb is 3 different new explanations in one time. More than that, patient will not retain. You're giving medicine to the patient. Patient will ask the question, what if this does not work? Then I'm here to help. Call our office. We will make sure that you are taken care of. Some behaviors I think should be avoided, such as talking too fast, which I am sometimes guilty of. Using jargons and acronyms, which I talked about before. Talking down to the patient. Don't be condescending. Don't be condescending to your patients. One thing which I see very frequently actually is talking louder on the face of a language barrier. If patients study their understanding, you're speaking in the same language but in a louder voice, that is not going to help. Again, interrupting the patient, which talked about, again, don't discourage questions, and explaining too much at a time will also backfire. What about this one? Even I don't understand what he's talking about. Last but not the least, hard conversations. It's hard. You can have conversations with your patients or your colleagues or nurses or PAs or APPs or whoever. First and foremost is to adopt a helpful mindset. So 3 C's are very, very important. 3 C's. What are those 3 C's? Adopt a calm, caring, and constructive attitude. Calm, caring, and constructive. Follow the hard conversation model. We'll talk about that in a minute. Address resistance with caring, broken record. I will talk about that in a minute as well. And if you're feeling resistance, open your mind. Maybe you will learn something new from your patient or from your colleague. I'm not sure that I learned new about diacriticosis, whatever that is. So here's the hard conversations model. Be upfront and state your positive intent. I am here for you. Let's work this together. Let's talk about this. Positive intent. Whatever you want to say, tell the truth fast. Don't just spill the beans. Don't sugarcoat things. Don't dance around the bush. After you've done that, listen and understand what the other person is trying to say. Once you listen to that, again, don't be ready to answer whatever the person is saying. Just listen and understand. Understand is the most important part. See where they're coming from. Then find a common ground where you both can have a conversation. At that point, identify options and whatever action you're going to take with your patient or your colleague. And then at the end, express appreciation. The caring broken record. There's 3 elements. So most important thing is that if you know that what you are recommending, you are not going to deviate. So your clear bottom line message stays the same, that I am not going to sign a release for not taking this COVID vaccination. Right? But your patient or patient's parent keep on coming back with some different excuse, then you say, I care about you. I care about your son. I care about you care about your colleague. So a lot of caring in between, but then repeat your message again that you're not going to do what you're asked to do because that's not what you are here for. So again, stick to your message, shows empathy in between, but stick to your message again. These are my references. I highly recommend the first book, which is The Language of Caring Guide for Physicians. It's a really fantastic book to read. And if you have any questions, I'll be happy to answer if you're live at the meeting. Thank you.